Hey everyone, it's First Dream. Think about who's really there for you or your loved ones during those vulnerable moments in healthcare. It's the nurses, right? And globally, nurses around the world face numerous challenges in their profession, spanning from staffing shortages to emotional burnout. These aren't just statistics, these are daily hurdles for the people who form the backbone of our medical systems, impacting their well-being and the care we all receive. It's a tough, demanding reality they navigate every single day, but here's what always gets me: their incredible strength. However, they continuously demonstrate resilience and adapt through various strategies and support mechanisms. They find ways to cope, to innovate, to push forward with compassion, even when they're stretched thin. They support their colleagues, advocate for their patients, and somehow keep that flame of dedication burning bright. It's this spirit, this unwavering commitment that truly defines them and deserves our deepest admiration and support. So in this video, we're going to explore these critical issues. We'll look at the systemic problems, the personal tolls, and the urgent need for change, because understanding their world is the first step towards making a meaningful difference. Their challenges affect all of us, and it's time we truly listened and acted. Let's begin. So let's talk about one of the biggest elephants in the room: staff shortages. It's not just a problem in one or two places, it's a global crisis. We're seeing a widespread, almost systemic, lack of trained nursing professionals everywhere you look. Imagine walking onto a hospital floor knowing you're supposed to care for, say, 10 patients, but today it's 15 or even 20 because there just isn't anyone else. This isn't a rare occurrence. For many nurses, it's the norm. The demand for care is skyrocketing, driven by aging populations who naturally need more medical attention and by the simple fact that more people have access to healthcare than ever before, which is a good thing. But it stretches resources incredibly thin, pushing existing staff to their absolute limits. And why is this happening? Well, it's complicated, a perfect storm of factors, really. We have an aging nursing workforce itself, with many experienced nurses nearing retirement, taking decades of invaluable experience with them. Then there's the issue of limited training institutions in many parts of the world. You can't just magically create more nurses. It takes significant time, substantial resources, and a core of dedicated educators to train them to the high standards required. And even when we do train them, we see a significant migration of nurses from less developed countries, seeking better opportunities, safer working conditions, and improved pay in more developed nations. While you can't blame them for wanting a better life and professional environment, it creates these huge, devastating gaps in their home countries, leaving already vulnerable healthcare systems even weaker. It's a brain drain that has profound, long-lasting consequences for global health equity. The impact of these shortages is, frankly, brutal and multifaceted. For the nurses who remain on the front lines, it means crushing workloads, mandatory overtime, and incredibly long, exhausting hours. Burnout becomes almost inevitable when you're constantly trying to do more with less, when you feel like you can't possibly give each patient the time, attention, and meticulous care they truly deserve. This, tragically, can lead to a reduced quality of care, as even the best nurses are human. Mistakes become more likely when staff are fatigued, stressed, and overwhelmed, and it creates a vicious downward cycle. The worse the conditions become due to understaffing, the more nurses leave the profession or seek less demanding roles, which only exacerbates the shortage and intensifies the pressure on those who stay. It's a critical situation that needs urgent systemic solutions, not just temporary band-aids, if we hope to stabilize our healthcare systems. Now, imagine going to work every day, not just facing the usual stresses of a demanding job, the complex medical cases, the emotional toll, but also genuinely fearing for your own physical safety. That's the stark reality for far too many nurses across the globe. We absolutely need to talk about workplace violence and harassment because it's a pervasive, insidious, and deeply disturbing issue that often goes underreported or dismissed. Nurses who dedicate their lives to healing, comforting, and advocating for patients are increasingly finding themselves on the receiving end of aggressive verbal abuse, being screamed at, insulted, threatened with harm, and relentlessly demeaned. And tragically, it doesn't stop at words. Physical violence, being pushed, grabbed, hit, spat on, or even more severely assaulted, is happening with alarming and unacceptable frequency. This aggression often comes from patients, or sometimes their families who might be stressed, scared, in pain, or frustrated with the system, but that stress never ever makes it okay or excusable to harm a caregiver. This isn't just part of the job, as some might unfortunately try to dismiss it, nor is it an acceptable risk of the profession. It's a serious occupational hazard with profound and lasting consequences. The mental trauma from these encounters can be debilitating, leading to conditions like PTSD, anxiety disorders, and depression. Think about carrying that fear, that hypervigilance, that anxiety with you shift after shift, wondering if today is the day you'll be attacked. It erodes your sense of security, your trust in the very environment you work in, and your overall well-being. This constant exposure to aggression, both verbal and physical, naturally leads to immense job dissatisfaction and a feeling of being unsupported. Who would want to stay in a role where they feel constantly under attack, devalued, or unsafe? For many dedicated nurses, it's the final, unbearable straw that pushes them to leave the profession altogether, a loss we can ill afford. The attrition rate due to violence and harassment is a significant yet often overlooked contributor to the critical staffing shortages we just talked about. It's a destructive cycle that feeds itself. When nurses leave because they don't feel safe or supported, the remaining staff are even more stretched, potentially leading to longer wait times, more frustrating situations for patients and families, and thus a heightened risk of further aggression. We have to break this cycle. We must create environments where nurses feel genuinely protected, unequivocally supported, and deeply respected. Their safety is non-negotiable, and it's absolutely fundamental to their ability to provide compassionate and effective care. This isn't just about adding more security guards. It's about implementing robust policies, comprehensive de-escalation training, strong legal repercussions for assailants, and fostering a widespread cultural shift that emphatically states violence against healthcare workers is never, ever acceptable under any circumstances. Beyond the physical dangers and the threat of violence, there's an invisible yet incredibly heavy toll that nursing takes: mental and emotional burnout. This isn't just about feeling tired after a particularly long or difficult week. It's a profound and debilitating state of emotional, physical, and mental exhaustion. It's caused by prolonged or excessive stress, the kind that chips away at you day after day. Nurses are constantly operating in high-pressure, high-stakes environments. Think about the relentless pace and critical decisions in the emergency room, where every second can mean life or death. Or the intense vigilance required in critical care units, where patients' lives hang precariously by a thread. They witness profound trauma. They are the ones who often have to deliver devastating news to families. They comfort the grieving, and they carry the immense weight of responsibility for people's lives and well-being. This constant, unrelenting exposure to human suffering, pain and loss day in and day out is incredibly taxing on the human spirit. This emotional labor, as it's sometimes called, is an immense and often unacknowledged part of their job. Nurses are expected to be empathetic, compassionate, patient, and composed, even when they're dealing with incredibly difficult, sometimes tragic situations, or feeling completely overwhelmed and exhausted themselves. They have to manage their own emotions while simultaneously supporting patients and families through theirs. Over time, this relentless emotional output can lead to what's known as compassion fatigue, a state where the ability to empathize actually diminishes, almost as a subconscious coping mechanism to protect oneself from further emotional pain. The emotional exhaustion can become so severe that it impacts every single aspect of their lives, seeping into their relationships and their sense of self. It's like their emotional reserves are completely depleted, leaving them feeling empty, cynical, detached from their work, and sometimes even from themselves, the very opposite of the empathy and connection that drew them to nursing in the first place. The consequences of this pervasive burnout are serious and far-reaching, affecting not only the nurses but also the quality of patient care. We see significantly higher rates of depression, anxiety disorders, and even suicidal ideation among nurses compared to the general population. Their own mental and physical health suffers tremendously. And when nurses are burned out, their ability to provide empathetic, high-quality and safe care can be compromised. It's not that they suddenly stop caring, but the sheer weight of exhaustion makes it harder to connect, to be fully present, to catch subtle changes in a patient's condition. This isn't a sign of personal weakness or failure, it's a natural human response to an unsustainable level of demand and emotional strain. Addressing burnout requires far more than just telling nurses to practice more self-care or be more resilient. It demands fundamental systemic changes to workloads, mandated safe staffing ratios, readily accessible mental health support, and a workplace culture that genuinely prioritizes their mental well-being just as much as their physical safety. Chapter 4. More than just a paycheck, the reality of inadequate compensation for nurses. Let's be completely honest with ourselves. We ask an absolutely incredible amount from our nurses. We expect them to possess a vast and ever-expanding body of medical knowledge, to be highly skilled in complex procedures, to be deeply compassionate and empathetic, to work long, grueling and often unpredictable hours, including nights, weekends and holidays. They deal with life and death situations on a daily basis, comfort the grieving and educate patients and families. Yet in so many parts of the world, and even in many supposedly affluent nations, a significant number of nurses are demonstrably underpaid relative to their extensive education, their critical and life-saving skills, and the immense, often crushing responsibilities they shoulder every single shift. It's a fundamental, glaring disconnect between the immense value they provide to society and the tangible financial recognition they receive. This isn't just about wanting more money, it's about demanding fair, equitable compensation for a demanding, essential, and highly skilled profession. When nurses are struggling to make ends meet, worrying about their own financial stability while caring for others, it adds another enormous layer of significant stress on top of an already incredibly challenging and emotionally draining job. They might be juggling student loan payments, worrying about paying their rent or mortgage, affording childcare, supporting their families, or saving for a precarious future, all while trying to provide complex, focused medical care to critically ill patients. This pervasive financial insecurity can be a huge distraction, a constant source of underlying anxiety, and a drain on their mental energy. It can lead to nurses having to take on second jobs or excessive overtime shifts, further contributing to their physical exhaustion and mental burnout. It really forces us to ask the uncomfortable question: how can we reasonably expect people to dedicate themselves so fully and compassionately to such a critical societal role if they're constantly worried about their own basic financial well-being and security? The detrimental impact of inadequate compensation goes far beyond individual stress and hardship. It contributes significantly to high rates of job hopping and turnover, as nurses understandably seek out better paying positions, sometimes moving between facilities or even leaving direct patient care roles for administrative, insurance or pharmaceutical jobs that offer more financial security and better work-life balance. This constant churn is disruptive to healthcare teams, impacts morale, and can negatively affect the continuity and quality of patient care. Low morale is another inevitable consequence when professionals feel their skills and contributions are undervalued financially. It can erode motivation, engagement, and job satisfaction, even for the most dedicated individuals. Ultimately, investing in fair and competitive wages for nurses isn't merely an expense to be minimized. It's a crucial investment in a stable, skilled, experienced, and motivated nursing workforce, which directly benefits patient outcomes, healthcare system efficiency, and the overall health of our communities. Chapter 5. Healing Hands, Empty Cupboards. The critical lack of resources and equipment. Now, I want you to picture this scenario clearly. You're a highly skilled, dedicated nurse. You've undergone years of rigorous training. You're ready to save lives, prepared to provide comfort and expert care. But when you reach for the tools you need, the cupboard is bare or the equipment is broken. This isn't a hypothetical situation. It's a harsh daily reality in far too many healthcare settings around the globe, particularly pronounced in low-income countries, remote rural areas, or regions devastated by conflict, natural disasters, or prolonged crises. We're talking about chronic shortages of absolutely essential medical tools, Things most of us take for granted, like sterile gloves, clean syringes, functioning vital signs monitors, essential medications, or even basics like soap and clean water. And when we think about the ever-present threat of infectious disease outbreaks, the critical lack of adequate personal protective equipment, or PPE, puts nurses and other healthcare workers directly and unacceptably in harm's way. It's akin to sending a firefighter into a raging inferno without a helmet, oxygen tank, or protective gear. The consequences of these resource shortages are immediate, tangible, and often devastating for both patients and providers. Patient care is directly and severely compromised. How can any healthcare professional provide the best possible care, the standard of care patients deserve, when they're constantly having to improvise with substandard materials, ration critical supplies, or make do with outdated, malfunctioning, or broken equipment? It inevitably leads to dangerous delays in diagnosis and treatment, increases the risk of healthcare-associated infections, results in suboptimal patient outcomes, and sometimes, tragically, contributes to preventable suffering and deaths. Nurses are forced into making incredibly difficult, ethically challenging choices, trying to stretch woefully limited resources as far as they can, often at great personal and professional risk, and with immense moral distress. The burden of knowing you could do more, provide better care if only you had the right supplies or functioning equipment, is a heavy one that contributes significantly to burnout and disillusionment. Furthermore, the persistent lack of essential resources, particularly adequate and appropriate PPE, dramatically increases the risk of infection and illness for nurses themselves, and by extension, their colleagues, their families, and their wider communities. During global health emergencies like the COVID-19 pandemic, we saw this critical issue play out on a terrifying global scale, but it's crucial to remember that this is an ongoing daily struggle in many parts of the world, pandemic or not. Nurses are consistently on the front lines, the first point of contact for the sick and vulnerable, and if they're not adequately protected, the entire healthcare system becomes more fragile and less able to respond. Ensuring consistent and equitable access to adequate resources, supplies, and well-maintained equipment isn't just a matter of logistics or budget allocation. It's a fundamental ethical obligation and a cornerstone of health equity. It's about unequivocally valuing the safety and well-being of our dedicated healthcare providers and, by extension, the lives and health of the patients they serve. We need global solidarity, sustained investment, and robust supply chains to address these critical life-threatening gaps. Chapter 6. Breaking the Glass Ceiling. Addressing gender inequality in nursing leadership. Nursing has, for a very long time, historically been, and largely still remains, a profession overwhelmingly dominated by women. If you look at the global statistics, women make up the vast majority, often 80 to 90% of the entire nursing workforce. They are, without a doubt, the compassionate backbone of patient care, demonstrating incredible skill, profound dedication, unwavering advocacy, and remarkable leadership at the bedside, in clinics and in communities every single day. They manage complex patient loads, coordinate care among multidisciplinary teams, and make critical decisions under pressure. Yet when you start to look higher up the healthcare organizational ladder, at the most senior leadership positions, the hospital CEOs, the chief medical officers, the health ministers, the influential policymakers, the heads of major departments, a very different and frankly disappointing picture often emerges. Despite their overwhelming numbers in the profession and their invaluable frontline expertise, women in nursing frequently encounter a stubborn, pervasive glass ceiling that limits their ascent to the top echelons of healthcare leadership. This isn't to say there are no women in senior healthcare leadership roles, because of course there are, and many of them are phenomenal, trailblazing leaders who are making incredible contributions. But when we look at the systemic patterns, the overall trends, leadership positions in healthcare organizations and policy-making bodies are still disproportionately held by men, even in a field where women form the vast majority of practitioners. This creates a significant and problematic disconnect. The individuals making crucial, far-reaching decisions about healthcare delivery models, resource allocation, staffing policies, and workplace conditions often don't have the same direct lived experience or frontline perspective as the vast majority of the nursing staff who are tasked with implementing these decisions. This can lead to policies and strategies that don't adequately address the nuanced realities, the daily challenges, and the specific needs faced by nurses on the ground. It's a profound missed opportunity to fully leverage the incredible wealth of insight, practical wisdom, and leadership potential that female nurses possess. The impact of this persistent gender inequality within healthcare leadership is multifaceted and detrimental. For individual nurses, it can mean frustrating career stagnation, being repeatedly overlooked for promotions despite their qualifications, experience, and demonstrated leadership capabilities. It can be incredibly demoralizing and disempowering to see limited pathways for advancement into roles where they could make an even greater systemic impact. More broadly, for the healthcare system as a whole, the lack of robust female representation in top decision-making roles means that the unique perspectives, priorities, and innovative ideas of the nursing profession, particularly those that might be more keenly understood or championed by women who form its majority, may not be adequately voiced, sufficiently valued, or effectively integrated into strategic planning. Advocating vigorously for greater gender equality and equity in healthcare leadership isn't just about fairness or ticking a diversity box. It's about building stronger, more effective, and more responsive healthcare systems that truly reflect and serve the needs of both their patients and their invaluable nursing workforce. Outro, a call to action, supporting our nurses, strengthening our future. It's a lot to take in, isn't it? The sheer scope of challenges our nurses face every single day. It's undeniable that nursing is a profession under significant strain, yet its practitioners show remarkable adaptability. They constantly find ways to deliver exceptional care, to innovate under pressure, to support each other through the toughest times. By embracing education, technology, advocacy, and mental health support, nurses continue to elevate healthcare globally, often against incredible odds. Their unwavering commitment to healing and compassion in the face of such profound adversity is truly extraordinary and benefits every single one of us, whether we realize it or not. However, admiration and applause, while appreciated, are not enough. Their incredible resilience needs our active, tangible support. The path forward includes significantly better investment in nursing education, ensuring a robust pipeline of well-trained professionals and supporting the educators who train them. It requires meaningful, enforceable policy changes that guarantee safe staffing levels, fair and equitable compensation, and zero tolerance for workplace violence and harassment. Crucially, it demands a concerted global effort to genuinely respect and support nurses' essential role in society, not just with words during a crisis, but with consistent, concrete actions that truly value their expertise, their labor, and their dedication. This is about fostering systemic change. Ultimately, supporting our nurses is about strengthening the very foundation of our healthcare systems and, by extension, our communities for everyone. When nurses are empowered, safe, respected, and valued, the quality, accessibility, and compassion of care improve for all. Let's move beyond awareness to committed action. Advocate for them in your communities, support policies that protect and uplift them, and let's collectively ensure these everyday heroes have what they need, not just to survive their demanding roles, but to thrive in them. Thanks for watching and for caring enough to understand.